Hi
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 everyone,
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 I'm Benedicta Aini.
I'm Brian Christopher.
I'm Claryssa Bianca.
I'm Dania Lakshmi.
I'm Erica.
I'm Nicolas Fernando.
Have you ever heard of the term sickle cell anemia? If not, then you've clicked the right video. Now, what is sickle cell anemia? Sickle cell disease is a group of disorders that affects hemoglobin, the molecule in red blood cells that delivers oxygen to cells throughout the body. People with this disorder have a typical hemoglobin molecules called hemoglobin S, which can distort red blood cells into a sickle or a crescent shape. This condition is inherited in an autosomal recessive pattern, which means both copies of the gene in each cell have mutations. The parents of an individual with an autosomal recessive condition each carry one copy of the mutated gene, but they typically do not show signs and symptoms of the condition. The signs and symptoms of sickle cell disease are caused by the sickling of the red blood cells. When red blood cells sickle, they break down prematurely, which lead to anemia. Anemia can cause shortness of breath, fatigue, delayed of growth and development in children, as well as the rapid breakdown of red blood cells may also cause yellowing of the eyes and skin, which are the signs of jaundice. The symptoms of sickle cell anemia may include pain crisis, arthritis, dactylitis, bacterial infections, leg ulcers, eye damage, septic necrosis and bone infarcts, sudden pooling of blood in spleen, and liver congestion. When a person has sudden attacks of severe pain due to lack of oxygen, this can be because of sickle-shaped cells that can stick on the vessel walls, causing a blockage. They may also stop blood flow. Symptoms of sickle cell anemia usually show up at a young age. They may appear in babies as early as 4 months old, but generally occur around the 6-month mark. 2 copies of the gene are needed to have the disease. If a person only has 1 copy of the gene, he or she is said to have a sickle cell trait. Sickle cell disease is caused by a mutation in the hemoglobin beta gene found on chromosome 11. This mutation causes an abnormality on the hemoglobin. Hemoglobin A, which is the normal hemoglobin, shapes the red blood cells into a smooth biconcave shape, making the red blood cells able to glide through blood vessels. People with sickle cell anemia, however, have hemoglobin S in their red blood cells. Now, who can get sickle cell anemia? Sickle cell anemia is more common in certain ethnic groups like people of African descent, including African Americans, people of Hispanic American from Central and South America, people of Middle Eastern, Asian, Indian, and Mediterranean descent. Around 70,000 to 100 Americans have sickle cell anemia, and about 8% of African Americans have sickle cell trait. The sickle cell gene is passed from generation to generation in a pattern of inheritance called autosomal recessive inheritance. This means that both the mother and the father must pass on the defective form of the gene for a child to be affected. If only one parent passes the sickle cell gene to the child, that child will have the sickle cell trait. In people with sickle cell disease, abnormal hemoglobin molecules, hemoglobin S, stick to one another and form long rod-like structures. These structures cause red blood cells to become stiff, assuming a sickle shape. The mutation occurs in the beta subunit when a valine replaces glutamate in position 6 of the beta subunit. There are several types of sickle cell disease. Sickle cell anemia, which occurs when substitutions in the beta globin genes is inherited from both parents. Sickle hemoglobin C disease, which occurs when there's a slightly different substitutions in the beta-globin gene that produces hemoglobin C and S. Sickle SP plus beta thalassemia, which occurs in individuals that contain substitutions in both beta-globin genes. The amount of normal beta-globin produced shows the severity of the disease. When no beta-globin is produced, chronic blood transfusions are needed. Sickle hemoglobin O disease, in which hemoglobin O is another type of substitutions in the beta-globin gene that also interacts with sickle hemoglobin. Sickle hemoglobin D disease, in which hemoglobin D is a different substitution from the beta-globin gene, but interacts with the sickle hemoglobin gene. Sickle cell disease brought many other health complications such as vaso-occlusive crisis, acute chest syndrome, pulmonary hypertension, priapism, and central nervous system diseases such as stroke and silent cerebral infarcts. Vaso-occlusive crisis is the hallmark of sickle cell disease. In sickle cell anemia, the hemoglobin molecule, which is hemoglobin S, tend to form aggregates that damages the red blood cell wall, resulting in the sickle-shaped red blood cell. This red blood cell tend to adhere to the inner lining of the blood vessels. They are sticky and they stick to one another, creating a blockage in the blood vessels. This blockage prevents oxygen supply to tissues and causes vaso-occlusive crisis, or VOC. Acute chest syndrome refers to a new pulmonary infiltrate accompanied by fever and other symptoms or signs of respiratory disease. Acute chest syndrome could be caused by infections or infarcts in the lungs or in the bone marrow. Usually, the first sign of acute chest syndrome is mild hypoxia, in which the tissues are lacking oxygen. Pulmonary hypertension is a condition where there is a high blood pressure in the lungs due to damages in the pulmonary arteries. As mentioned earlier, sickle-shaped red blood cells form aggregates that stick to one another and forms a blockage in blood vessels. The most central nervous system disease associated with sickle cell disease is stroke and silent cerebral infarcts, or vasculopathy. The presence of cerebral vasculopathy compromises the cerebral blood flow. Silent cerebral infarct is the most common permanent neurological injury in children with sickle cell disease. While stroke usually affects patients between ages of 20 to 29, they are more common in older patients. Strokes may also be associated with other neurological deficits. About 10% of children with sickle cell disease could also develop stroke, which may lead to physical limitation, such as hemiparesis. Priapism is another type of vaso-occlusive event that's common in male with sickle cell disease. It's a painful erection of the penis, and it's not related to sexual stimulus or arousal, and it lasts for a long time. Priapism is caused by the sickling of red blood cells in the penis. It blocks the blood vessels and stops blood flow out of the penis. We've talked about what sickle cell anemia is, what are the symptoms, how sickle cell is inherited, and what complications can sickle cell anemia lead to. Now, let's talk about how sickle cell anemia is diagnosed. There are several diagnosis techniques: blood test, hemoglobin electrophoresis, and prenatal diagnosis. There are some treatments that have been labeled as successful in treating patients with sickle cell anemia. The treatments for sickle cell anemia may include pain medications to help ease the pain, IV injections to rehydrate the body, immunizations to help fight against infections that could lead to further health complications, blood transfusions to return hemoglobin level to normal, supplemental oxygen to help breathing and supply more oxygen to tissues, and hydroxyurea, which is a medicine that helps the red blood cells to have a bigger shape and prevents the sickling of red blood cells by increasing the amount of hemoglobin F.